Hello, Dr. Ahadian here. How you doing? I wanted to talk about a continuation of issues with regard to eating disorder, which has been very much under question, and a lot of questions about that was directed to me. The issue with the eating disorder basically has a concept of biological, environmental, psychological, and genetic factors. The genetic factors basically is that we are all human beings and susceptible genetically to the way we deal with our environment, which again could be, interestingly, go back to the issue of possibility of the behavioral pattern in a family and a tribal ancestorial history of a human being, which has caused certain genetic precondition which is very difficult to discern. Is as if like the egg came first or the chicken. However, the issue based on how we treat food is extremely important in the eating disorder pattern and psychology, which is based on the issue that the food is allaying and decreasing the anxiety that the person faces, which is caused by any type of anxiety, mostly the separation anxiety and the annihilation anxiety and losses, which exhibits itself in the matter of dealing with the anxiety of separation and loneliness and loss by food, which goes back to the early childhood and infancy with the relationship of mother, father, and the child, and how they deal with the issue of decreasing anxiety of the baby. And therefore, the food becomes a matter of calming the person, and therefore the person eats, and therefore at times the problem becomes with regard to the guilt about eating and overweight and then throwing up, which causes the issue with regard to bulimia. And the issue with anorexia could be used as a control and the defense against giving in this fear and anxiety. Now, the way to change this behavior is basically not to connect that to the anxiety related to the overweighting and the weight of a person, but to look at it in a matter of first decreasing the anxiety that caused the person to begin to eat, to calm him or herself down, which ends up into the changes in the pattern of behavior, which I make an example basically as far as dealing with the separation anxiety and issues with regard to guilt related with the behavior in a family system by getting a treadmill. Walk and run in the treadmill at the same time. You are running away, separating, however, you're still there. So then the guilt of separation, of loss, of changes, of becoming another person is not going to be provoked, and therefore the problem is going to be solved not just by decreasing weight because of running on the treadmill, but the separation, the individuation, and the sense of independence. We'll talk about that later, more about this issue. Thank you.